is Thais, and I'm a social worker at Levine Cancer Institute University location. I'm recording this video to help patients understand what to tell the children when they find out about their cancer diagnosis. Through this workshop, you understand what kids understand at different developmental stages, talking about cancer, tips for answering questions, and way to help your child. These are some resources of Cancer Support Helpline. Open to Options is a research program that can help prepare lists of questions to share with your doctor. And Franklin Speaking About Cancer is a landmark education series, provides trusted information, a variety of topics important to people affected by cancer. They make their information available through print and digital publications online and in person as well. So children can feel that things are happening in their environment. They're very intuitive. Although it's not a one size fits all, if you have different kids at different developmental stages, they're going to need to be told in a way that's understandable to their developmental stage. They should not feel forced to act or feel a certain way. It's okay for them to either feel upset or scared, and we should normalize that. So, from infancy to toddler years, they don't really have an understanding of cancer, but they are able to sense changes in their environment and routines. They're very aware of changes in their behaviors, and they can pick up on the feelings of the adults around them. Some common behaviors you might see is intensified tantrums, changes in eating and sleeping habits, some clinginess and separation anxiety. I know these behaviors are common in this age, but you would just see them be more intensified. In preschool age children from 3 to 5, they have some understanding of illness or not feeling good, such as, I have a cold or a fever. They have a little understanding of a serious illness, such as, HIV or cancer. And they have magical thinking, such as, thinking that they can either make it go away or that feelings that they've created it. Those are common feelings that they might think in their magical thinking. Some common behaviors and feelings would be you would see some regression. So if they are, for instance, potty trained, they might start wetting the bed again. Outbursts of intense emotions, repeated questions, which is how they show like their anxiety and need for being validated or asserted, separation anxiety, and you will see them play it out or act out things related to illness. So when they're playing with their Barbie dolls or puppets, you might hear them say sick or dead or don't feel good type of thing. For school age children from the ages of 6 to 8 years old, they can usually understand the difference between a simple illness and a serious illness, although they might not have all the right information about specific illnesses, and also they do have magical thinking. And for school age children, some of the behaviors and feelings you will see would be regression, a lot of worry, fear, and that comes with them constantly asking the same questions. Separation anxiety, you will see them playing and acting out. You might see more anger, with the disruption in routines, distancing themselves, in school or at home. And you might see more acting out behaviors at school, which is, typically a safe place for them. Um, so that's where you would see a lot of these acting out behaviors at school in isolation as well. Middle school age children from the ages of 9 to 12 years old, they often have a basic understanding of cancer, although they might not have the right information. Magical thinking is common as well. Common behaviors and feelings is they would hide their feelings, not really talk about it openly, and worry and fear, anger, express fear and sadness as anger because they wouldn't have the right words to express that, they're worried and fearful of a parent having a serious illness. We talk about anger as an iceberg emotion with all of these other feelings underneath it, such as anxiety, fear, insecurity, and they might also feel embarrassed that this is happening to them. This is all very in their family unit, very common for this age group. And again, you might see some acting out behaviors at school. Things, declining grades or peer group changes or engaging in behaviors that they didn't before, like fights or wanting not to play a sport they had played before. Those are all common ways that kids would express their feelings and worries about what's happening in their family unit. For teenagers between the ages of 13 and 18 years old, some common behaviors is that they would struggle with their like wanting to be independent, their own selves, and then questioning if they should stay close to their family unit. They might have some anger if their routine is disrupted. They might try to hide feelings and take out their frustrations on their family members because they might not really have an understanding that this isn't something that anybody wishes or wants to have, and then they may have fear that it will happen to them because it happened to their family member. So that might come out as anger when they have this fear, worry, and anxiety. And their understanding of serious illnesses is basic, although they might have misinformation and they might think a lot about life and death and the meaning of life. And again, you might see changes in their peer groups, grades, behaviors. Um, Talking about cancer, there is this patient who said, my children would rather I communicate openly than to leave it to the imagination. Why imagination is great in this case, knowing the bad results that cancer can lead to, they would rather have the knowledge. This is a father of a colon cancer patient. So, like I said in the beginning, it's always best to be truthful to them at a developmentally appropriate age, right? So for little kids, they will see like body changes and know that, maybe after receiving chemotherapy, a few days after, you don't feel well. So it's important to tell them that, you're getting treated and with the hopes to improve if that's the case, or if it's palliative, like the hopes of having a good quality of life. And for they might have a lot of questions, and it's always okay to say, I don't know. Like, for instance, if they ask, are you going to get better? And you might say that's the hope, but sometimes it doesn't improve as we wish. And if it doesn't, I have a doctor who's with me who's gonna, talk about different treatment options. When talking to the children, it's important to prepare yourself, do it at a time where, it's like calm, it's not in a rush type of environment where you might have something to do next. It's important to use language that's appropriate to the developmental age. It's important to be with them, physically, emotionally, and to have open communications. Most parents says that the children did not openly talk with them or share their feelings about cancer. So after having the conversation, it's important to leave a space for them to ask questions. And they might not have any questions right away because they're just taking in the information, but to always make that available to them, whether you check with them in a couple of days or if you know, do check-ins after each doctor's visit. And that's something you can do in that conversation and say, I want you, to be truthful and open with you. Would it help if I talk to you after every doctor's appointment? Do you want to just ask me questions as you might have them? That type of things. Some of the common questions that they might have is, what is cancer? And I always encourage parents to say, I'm thinking more about the younger age group. There are cells, they divide, and that's a normal thing that happens. And when cancer happens, is that they just divide incorrectly, and that makes it create a like a ball, and that's referred to as tumor, and that's what you're treating is that tumor, trying to make it go away with, some strong medication. Can I catch cancer? And that's important to tell them, some cancers are genetics, others just kind of happens, and that the doctor would know to refer you to genetics and if the children need to get tested, that kind of thing. And what is chemotherapy, radiation, and surgery? Just explaining to them that those are the different types of treatment that doctors do to try to make the tumor or the ball go away. And why are you losing your hair? Some other body changes that might happen is, like losing weight. And I would explain to them that that's just a side effect of taking some really strong medication to make the cancer go away. And, that hair grows back and that eventually will be the case once the treatment is completed. Do people with cancer die? Are you going to die? And what is going to happen? And um, I would encourage you to tell them that, you know, death is kind of just what happens in life. Everybody dies. But hopefully, with the treatments, it won't be cancer that you would die from. But if that's the case, if it's, palliative, I would say something like, no, the doctors are trying to treat me to keep me alive as long as possible, keep the disease under control. And what is going to happen? It's okay to say we're treating it with the intention of getting better or with the intention of controlling the disease and making me be here for as long as I can. And they might ask for permission if they can talk about cancer with other people, such as friends and teachers. And, of course, it's up to to you to decide your comfort level with letting the community know. But I would encourage them to at least have a few safe people that they can talk to about what's going on in their family unit that can help bring some comfort and an outlet for them. Tips and tools for helping your child is always to encourage open communication, share and validate their feelings, maintain a routine to the best of your ability. Stick to the rules. Structure is what makes children feel safe. So maintaining a structure is very important. Allow them to help by doing things such as, keeping your room clean or continue to do well in school. And I would connect with the school and let them know what's going on at home just so that they're aware if there are any changes in their behavior, if they notice to have that also that open communication with school staff. Some ways that you can help your child is to seek outside support. For instance, here at Levine Cancer, we have therapists who can provide support to the family member or somebody in their family unit who might be struggling, as well as we partner with other companies who specifically work with children who have a parent or a family member going through a serious illness. Um, s- if you notice extreme changes in behavior, isolation, difficulty at school, loss of interest in activities they used to enjoy, a desire to hurt themselves or someone else, it's very important to get them connected to services like a therapist and maybe even psychiatrists if it's, to the point that's very worrisome. So this is a book that you can download the link here. It's called Frankly Speaking About Cancer. It helps a general children have a general understanding of cancer. It helps with finding ways to talk to them and some common behaviors you might see and ways to support. It's a free link you can click and print and read it with your family. There is a quick guide here that it's a video you can look at for information about a child's general understanding of cancer, ways to talk to them about cancer, and common behaviors you might see in children, and ways to support your family through this experience. It's a quick video, but that has a lot of good information. There's this radio show on talking to your children about cancer. Again, it's just this link here. You can click and get that information. Happens on Tuesdays, 4 p.m. our time here, Eastern Time. Some more links here for other resources. Cancer support communities, Camp Cancer, Cancer Care, Kids Connected, Children's Treehouse Climb Program, Imaginary Friends Society. This is a program, it's called Cancer Experience Registry. It's for the cancer support community where you might have other peers who have experienced the same and are going through this similar things as you, and that can really help find some support or advice. This is the Cancer Experience Registry information. And some grassroots movement with the cancer support community as well, that they have some up-to-date information and key issues important to patients with cancer and their loved one. You would be part of a network that interacts with Capitol Hill and policymakers on important issues to cancer patients.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.